Hello, and welcome to another episode of Patient Conversations with Leah. Today, I'm very excited to welcome Ashley to our show. Ashley is also a stage 4 lung cancer patient, diagnosed under the age of 50. So I'm going to turn it over to Ashley in just a second and let her share a little bit about her journey and diagnosis thus far, and then we'll dive into some pretty exciting topics that I think many of our listeners will relate to. So Ashley, I'll turn it over to you.
Hello, I'm so excited to be here. I'm 37. I was diagnosed at 34. And my diagnosis story, I think, is unfortunately very common. I started experiencing all of the, what we now know to be lung cancer symptoms, sore throat, chronic cough, pain in my chest, fatigue, explained weight loss, and I went in over the course of 366 days, around 20 times, and not just to my doctor, but to specialists in the ER, in urgent care, my nurse practitioner. And I was misdiagnosed with, you can think of it, name it. I was misdiagnosed with it, chronic cough, long COVID, pneumonia twice, anxiety. I was gaslit and rushed through every appointment until I went to the ER again. And I said, I don't have pneumonia. I don't know what to ask for, but something is really wrong. And if I leave, I'm going to die. And thank goodness this young female doctor really listened. I felt like she was kind of the first doctor to really look at me and say, wait, you get dizzy when you stand up? And I'm like, yes, like what you see is not me. This is not who I am. I was running half marathons a year and a half ago. And now I get dizzy when I stand up, like something isn't right. She ran some tests. I turned out I had a blood clot, a pulmonary embolism. I was then later admitted and finally given a CT scan when they diagnosed me with lung cancer.
I hear this all the time, and like you've heard it too. It's just this delay. It's never even on anybody's radar. And of course, it wasn't on our radar because, why would that be on our radar at our ages and with our, our health history? And apparently it's not on the radar of many doctors either. And nothing is really definitive, and nobody seems very pressed to figure out what exactly is going on. It's like they'll almost just pass you on to the next person, see if they can figure it out.
Because we don't fit that profile, right? Of the
Right.
stereotype of like who can have lung cancer, which, as we all know, we've all been programmed, unhealthy, older than 65, maybe male, chronic smoker. And as you know, that's not the case anymore. Or maybe never has been. Like there are many young health women being diagnosed.
So after your diagnosis, after those long 366 days, I cannot imagine. I thought mine was long and it was 4 months.
That's long. Yeah.
Yes, but not as long as yours. Kind of what's your journey been since then?
It has been a journey. So I didn't understand biomarkers at all. You're inundated with information when you're first diagnosed and you're barely retaining any of it. But I remember a meeting with my then oncologist who said, you don't have any biomarkers. You have no genetic mutations. And I remember saying, like, yay, I don't have genetic mutations. I didn't know what it meant, but it sounded like a bad thing. And he's like, no, this actually maybe isn't a really a good thing for you. And at that point, because I have no mutations, no targeted treatment, I started with chemotherapy. I did 4 rounds of chemo, started off at the same time with immunotherapy. It was at this point contained in my lung. I had one lesion in my spine. I did 5 rounds of radiation for that. And after like 6 months, it was unclear if I still had cancer in my lung. There was a lot of consolidation. And at that point, I'm like, I want a removal. I know that it historically has not been offered to stage 4. I know that you, Mr. Oncologist, said I'm not eligible for it, but I need you to give me the top surgeons in our area that are the most aggressive. I met with a surgeon. He agreed to do the removal, and my scans continued coming back clearer, like the consolidation was shrinking. And he then changed his mind. And I don't really know why. My oncologist, I then switched hospitals. So my new oncologist didn't know why. And I was pretty pissed, to be honest with you. I wanted that removal, and I did not want to go through with radiating the lung. I felt strongly about that. So I went to the East Coast, met with another surgeon. She said, of course, you're a great candidate. However, I have a colleague that works in Oakland, which is an hour from where I live in Santa Rosa, who, focuses on young, otherwise healthy women who are being diagnosed at, increasing rates. So met with my surgeon at Kaiser, Dr. Bellotta, and had a lung removal 2 months later.
Wow.
Yeah, after that was a year and a half ago. After the removal, I've been doing like spot treatment with radiation. I also was continuing the immunotherapy, got really sick, and it turns out I had a reaction to the immunotherapy. I was basically going into liver failure. So I had to stop the immunotherapy. So since then, I've just been spot treating with radiation. And it's getting to the point now where I am exploring clinical trials. And
So to me, that sounds really overwhelming. You're saying, I didn't even know what biomarkers were. They tell me I don't have a genetic mutation. You're like, yay, one for the team. And then to find out that that's not necessarily the best thing.
Mhm.
And to start this path of chemo and immunotherapy and to have the forethought to say, I want surgery, I think is really amazing. You know, when I was first diagnosed, we asked about it and they were like, oh no, they don't do that for stage 4. And we were like, oh, okay. You know,
Yeah.
so I kudos to you for like sticking to that idea if that's what you really wanted. You know, you mentioned clinical trials, but
Mhm.
when you're talking about clinical trials, you know, a lot of people perceive clinical trials as like, you have no other option or you are on your deathbed. And maybe I think that you've had enough experience like investigating clinical trials that you can kind of explain to people what is a clinical trial in terms of who's it for.
Yeah, I mean that was my understanding also, and but I did go to the East Coast again to meet with some of the top oncologists in the nation, at some of the top institutions to learn about trials and get second opinions after I had immunotherapy induced hepatitis. So I was told, and I just this really resonated with me. It may be a good idea to do a trial earlier on than you think because your body is strong. So if people wait till they're like on their deathbed, and they're weak and they're fatigued, they may not be strong enough for the trial that otherwise could have had really good results from. So that really resonated with me. I
That's
do have other options than a
that's
clinical
great advice.
trial. It is really great advice. Like I never thought of it like that. I always considered it to be like, oh, we're guinea pigs, and which maybe we are in a sense, but at the same
No.
time, like there are some really great trials out there, and there are like the Go To Foundation has been giving me a lot of support because I do have, I'm told, like a rare, unique case of having only like a rare fusion and no targetable mutations. So I've been receiving a lot of help, and there are so many great trials out there. And like I said, I do have other options. It's hard though to know what trial I should go on. And I do feel, in a sense, I'm sort of outside of the help from a few patient advocates and Young Lung and Go To. It is a bit isolating. Like at the end of the day, I'm having to decide what trial to go on, and I'm not an expert. And it seems like everyone has different opinions as to what trial is best for me. It is hard. Like I'm excited about going on to a trial that may really benefit me, but at the same time it's a bit of an isolating process.
Yeah, I could understand that because I think some of what I found, and I think a lot of patients find, it's nice to know someone on the same treatment as you, same path as you, because you can say, "Are you experiencing this?" or "Does this happen when?" So when we're talking about these trials and feeling like you're kind of alone in the situation and you're having to navigate this yourself, can you explain? I know you've mentioned different places are helping you find trials. Is it up to you as the patient to call to see if you qualify, or is your oncologist like a partner in getting you into these trials?
I'm not sure if other people have different experiences, but from what I've experienced so far, I've been told by my primary oncologist to basically move forward in a direction that you feel is right for you. He recommended a few, Go To recommended a few. I have like 6 or 7 that now I'm needing to reach out to, and they all need different things from me. Maybe a biopsy, maybe tissue. Some of them have prerequisites. I have to test positive for something to be eligible for the trial. So not only do I have to move forward with a trial, but it could take months and months to go through all of their testing only to be told, sorry, you're not actually eligible for this. On top of
Okay.
it, right now I have one nodule in my chest cavity, and it hasn't been large enough to even qualify for a trial. And that's been the case the last year is things have been popping up, but they're not measurable. And not only do you need one, but you need 2 sites of disease. And I'm told it can't be a bone lesion. So you need, a doctor made it kind of a bad joke, but he said, let's hope for a liver lesion. And I'm like, come on, man, because it's easy to biopsy.
That's
So it's pretty terrible, but you have to laugh at like the dark, weird humor at this point. So at this point, I don't know if it's measurable. I don't know if I have other sites of disease because on scans it says suspicious, like concerning areas, but at this point, I only have one. So I'm sort of waiting until I'm diseased enough to even move forward with a trial. And then it could take months and months to be told you're not eligible for this trial. So then you're jumping onto a new trial to be told the same thing. And I think that's worst case scenario thinking, but
yes.
it is some people's reality. And I'm hoping it's not mine. I hope that I can move forward with a trial that is right for me and there's no hiccups.
It's a lot on your shoulders. Like you said, you're not a doctor, you're not an expert. I mean, you're an expert in your own particulars, how you feel and all that. You know a lot about lung cancer, but you've not had formal education on how to do this. And I could see how it could be very overwhelming for sure. So when you get to this point, is there a common location where all trials are like cataloged, or is it just you talk to different people and they know of different things?
Yeah, there are like different paths someone with lung cancer can go to. The first one is, I think, clinicaltrials.gov. I could be wrong. And you can go in and you can select like your cancer diagnosis and your staging and maybe your treatment. I've only been on there once and it was a while ago. And it will show you trials, I think worldwide, maybe just in the nation. I think you can also type in the radius as well. So that's why I've really been leaning on the experts, like people. There's a molecular biologist at Go2 that's been providing so much support for me. Young Lung has been providing support, and I've had a patient advocate. So I'm really leaning on these experts to sort of guide me. So that's another resource for people outside of clinicaltrials.gov is
Well, that's good. It's
your
good to know that there's other places that you can get this information. I mean, I
Mhm.
just can't imagine. Like, the reality is a lot of us will be faced with making a choice between another treatment or that's already in existence or a clinical trial. So I think it will be good for people to hear that there are organizations and patient advocates and ways to kind of like start finding where you belong almost.
I think that's so important for us in the lung cancer community, not only to lean on each other. And that's why I love Young Lung because like it's people under 50, like we all can relate, or is it 55? I don't know. We all
50.
can 50, we all can relate to each other's experience because as you know, being young with lung cancer, we have a unique set of needs. So, in the same breath, talking to people that have been on the same treatment as you, and especially with no biomarkers, like there are many people that reach out. Like I was just on, Instagram, I was just diagnosed with lung cancer. I don't have biomarkers. Like I'm told my prognosis is, poor and this and that. And it's, I think, really important for them to talk to me and for me to talk to them.
Totally agree. I think that's one of my favorite parts of Young Lung because when I was diagnosed 5 years ago, there was nothing like this. And it was just, you would Google and Google and Google trying to find people. And then if you were lucky enough, somebody would, connect you with someone. But I think the support that you get just from like people that are in the similar life stages that you're in is tremendous. Well, I want to thank you for joining us today. I think that this, even though we're not experts on clinical trials and, you don't want to be held like to the wall with what you're saying, I think it's good for people to hear that there is support, there are trials out there. And I like the part about being strong enough to tolerate a trial and not waiting until you're not strong enough to try, to benefit from the trial. I think that's great advice. For those of you that are watching, please tune in to our next segment with Ashley, where we're going to talk about how your life perspective changes when you're handed a stage 4 diagnosis at such a young age.